run into patients that have it, okay? Painful swelling of the joints, and particularly around the ankles and the feet, because that's where we put all of our pressure, is where people feel it. And what happens is you actually get a buildup of uric acid, and the uric acid forms itself into little crystals that tend to work their way into the joints. It actually just sounds painful. I picture all these like sharp crystals in the joints. So that's hyperuricemia. Our bodies can't seem to get rid of it. And there are also some treatments, for instance, for patients that are going through cancer chemotherapy. You know that we're actually killing cells off, right? Killing the bad cells off, hopefully. And in tissue necrosis, uric acid tends to build up. So they may wind up with something like gout or these kinds of painful joint problems. So they're often given these medications, as we'll talk about. We know that colchicine is one of the medications that this disease does respond to. And different medications are given for different reasons. So for acute attacks, people are generally given NSAIDs for pain and colchicine to get rid of the uric acid. To prevent gout, for people that tend to get it, they're given probenecid or allopurinol. They work for slightly different mechanisms. These are pretty simple. So the colchicine, again, for acute attack of gout, as soon as you start to feel it, so people that get gout know that they start to get those first signs, they start taking it right away, okay? The first hour, okay? And they take it again and they take it again. 80% of people that take this medication, and you can see why people might want to take it, get very significant GI upset, nausea, and vomiting. Okay, they're just in for a really bad couple of days. Okay? Rarely they could get bone marrow suppression or hypersensitivity, but generally it's going to be the GI upset. And they're given NSAIDs, usually ibuprofen for pain. The allopurinol, okay, is one that's given preventively, and it actually inhibits uric acid from being synthesized. Okay, so it's used to prevent the uric acid to begin with, and this is the type that would be given to chemotherapy patients. Okay, to prevent the uric acid from forming with all of the cell death. Okay. Probenecid actually gets rid of excess uric acid. Okay, so depending on the reason that you get gout, they would give you one or the other. So it causes the excretion. It actually blocks the new Ch5, those little crystals, from being formed. And GI side effects can happen, like we talked about. Headaches, and interestingly enough, sore gingiva can also happen as well. So you might have a patient that's experiencing this. It can increase the levels of NSAIDs and penicillin in the body, so you have to be careful about that. So in this case, aspirin or acetaminophen are given for pain. Even though there was some talk about aspirin with the uric acid, in certain circumstances, the doctor would recommend this, okay, because of the effect it could have with NSAIDs or penicillin. So with this particular drug, it would be aspirin or acetaminophen. And that's gout. That's it with it. Not bad. You guys good? No. I know. Your brains hurt, right? I know. It's pretty straightforward stuff. Take it all in. Take it all in.